Ladies and gentlemen, I, on behalf of Organizing Committee, NAMSCON 2014, and AIIMS Rishikesh, welcome you all once again. Today, we will be having a symposium, a national symposium, on harmful effects of alcohol consumption, need for evidence-based national policy. This symposium will be held for the whole day. We have various learned speakers on various aspects of alcohol and alcoholism. Before we start the scientific session, I'll make a humble request to all the people present in the gathering to kindly switch off their mobile phone or kindly keep it on vibrator mode. Before we start the session, I'll be requesting our respected director, Professor Dr. Kumar, who is an internationally known neurosurgeon. He is the founder director of this institute. He started this institute. He is a graduate, postgraduate from GSVM Medical College, Kanpur. He has his MCH from AIIMS, New Delhi, and he has done PhD in 2012. He is a member of 8 international and other national societies. He has, to his credit, more than 400 publications till now. He has authored almost 140 chapters in various well-acclaimed textbooks. He has authored 7 textbooks till now. This is a very brief introduction. As we will go ahead with the program, we will be introducing him further. May I request, sir, to kindly announce the objectives of the symposium before we start the session.
Well, good morning to all of you. We are very fortunate to have our senior faculty members more than our teachers. In fact, I am seeing senior people. Probably they are more than my teacher. Professor Haribhai Patel was superannuated when I was not born in medical science. So, and madam, when I was doing MCS, she was head of department of gynae there. So it is good to have you here, all of you. Dean has already welcomed you. That was just a formality. But as a head peon of this institute, I would like to put to our guest that you are very much in this serene land of Rishikesh, the land of saints and sagas, and the people who have devoted their lives here. This place is still different in relation to other places of this country. And it is very much on the bank of the holy river Ganges. And you can sometimes from this floor only you can see and witness the scenic beauty of Himalayas, which is starting on the other end of the Ganges. And you stand sometimes at the bank of Ganges, the air blowing from the mountains touching the Ganges will touch your body and it will give you a real sense of humility. I mean a different kind of sensation altogether. You just practice it. So I need not to do that formality. Yes, as far as the objective is concerned, this was the job to be done by Honorable President Professor Bhaskaranji, but somehow he is not reaching in the time. So I have been asked to do this task for him. As far as the alcohol is concerned, how many minutes I have? Only to read 1 or 2 minutes? Achha, 10 minutes are too much. Well, my dear students, particularly I want to share it with you because you are the growing birds of this country and sooner or later you are going to lead for the ailing society of this country. I have no hesitation in saying this, that this country is harmed by so many factors and one of them is alcohol. Probably alcohol has done equal harm as the caste system of this country. I am saying it because I mean it. Had not there been casteism in this country, probably our situation would have been different. And as Madam has said, the alcohol is one of the another factor which has harmed this country like anything. There are many things which have harmed. Before freedom, I was hearing the speech of Honorable Subhash Chandra Bose, as he proclaimed very clearly that this country was suffering from poverty, ineducation, superstition, ignorance, and that so many factors were rampant in this country before independence. But alcohol is one thing which has emerged as a profound factor to devastate this country in today's scenario. Country has come up very well following independence, and you know it has grown very well. The scientific infrastructure led by our Honorable Prime Minister Pandit Jawaharlal Nehru is seen today to be proliferating, and the scientific milieu has taken over the superstitions during last 60 years in this country. But this damn alcohol, despite the regression of alcohol, it has come up very well, and international market is eyeing towards this country because many females in this country, nearly 89% females, have never tasted the alcohol. And the European countries and international community is eyeing as to how these ladies are not drinking here. This is a big market available. And not only females, even the male of this country, there are many good population of male. According to one study, probably nearly 80% of the male even don't take alcohol. They have not taken alcohol. So international market is eyeing toward this country, and international market is seeing that this is probably a big market available to them because they are taking it day and night in form of beer at the place of water, and how these damn Indians they are not taking. So probably the alcohol is one thing. Once the casteism and religion is fading in this country, superstitions are fading in this country, this alcohol is taking upper hand. These are personally my views. I am not talking any literature, etc. Well, so very thoughtfully this topic was chosen, and I thanks to Professor Bajaj. Oh, this name, my head bows to Professor Bajaj. He is such a esteemed teacher, high-grade academician, high-grade thinker, probably profound, prolific mind, very mindful in everything. And you know he is Padam Sri Padambu. These are very small things for actually him. And he very thoughtfully asked me to organize this third CME of this institute, and that was on alcohol. Needless to say, the India is a big market for alcohol. We produce alcohol, probably 60% alcohol is produced, 60% of Southeast Asia alcohol is produced in this country. This is the raw data available. I am not talking about the alcohol which is produced in every house in the hills. That is the kacha sarab. That is the country-made alcohol. I mean, the way the Chinese are producing small toys, and they are learning the skills for producing some highfalutin things. In our villages, the alcohol is so rampant that it does not require any teaching. They are born with the technique and they can produce any kind of alcohol. And if you talk about the Uttarakhand, as far as the statistics goes, in Uttarakhand, 60% of the people after sunset, they actually they are in different world altogether. They take alcohol and they visit Honorable Indra's Sabha in heaven probably. And after that, I am witness to it, after that if you are not a smart driver in Uttarakhand, probably you are going to be hit by one or other vehicle or car. So it is a word of warner here that please, particularly for guests, ask your driver to be cautious if driving after 8 p.m. Well, this is a very duly chosen subject, and it requires lot of attention. I have said about the justification as to why this topic was chosen. There is no national policy till date. There is no legislature available in this country which can curb the menace of alcohol. And we as a medical fraternity can do very little about it. So I am going to read the objective for Honorable President, on behalf of Honorable President. And the objective of today's symposium are these followings. Number one, to demonstrate comprehensive knowledge of prevalence of alcohol consumption in different parts of country and various causative factors leading to the use of alcohol and its related disorders. This is the first objective. So prevalence of alcohol consumption and the factors responsible. You know factors. In this country, people drink when they are happy, people drink when they are sad, people drink when they are boring, people drink when they have no job to do. And the country has lot of work, but people have every reason to drink in this country. The way the sweet is prevalent in this country. When you are born, then sweets are distributed. When you are dead, then also sweets are distributed in one or other way. So alcohol almost has become an integral part of our inhabitation. So first objective is to demonstrate comprehensive knowledge. Number two, recognize the alcohol use disorder in patient with community. So you will have to see as to what is the effect of alcohol in community itself, and the management at public and at the level of public and private sector. This is the another objective. So first is the consumption of alcohol, its factor responsible. Second is the community level effect of the alcohol and management. And third is the medical objective, and that is to diagnose the medical, obstetric, nutritional, cognitive and health related disorders of alcohol. This is the very much job of the physicians, doctors, and this is principally our job. The fourth is to describe the requisite protocol for primary care management of uncomplicated cases. If the alcohol is in a very initial stage, somebody is taking and probably going to be addicted in days to come without complications. So we need to produce a protocol for such group of the people. Simultaneously, the criteria of reference of the complicated cases of alcohol to be referred to secondary and tertiary level. The next objective is to counsel the patients with alcohol related problems and motivate their families to ensure continuity of health care. So counseling remains a very integral part of medical care today, and this is also included with alcohol. Next is to propose multi-professional strategies to ensure interdepartmental government coordination between health and other social sectors. So nowadays in medical profession, everybody is trying to indulge into multi-professional activities in order to have better results. So this is one of the objective. This is along with the Ministry of Social Justice and Empowerment, Ministry of Health and Family Welfare, and Ministry of Human Resources Development. So something needs to be done with the involvement of these ministries to stop or to prevent the menace of alcohol. Next is to establish the facilities for social rehabilitation. Those who have given up alcohol, there should be something to facilitate them and simultaneously to facilitate the rehabilitation of society indulging into alcoholism. Next is to generate awareness of the role of National Health Mission and intervention strategies to reduce the alcohol consumption in the country. How can the consumption of, which is increasing in this country during last decade, and the market of alcohol has also increased. So this is also one of the objective following discussion as to what can be the legislations, lessons, what can be the rules, or what can be the social motivations, or what can be the families motivation or motivation in its schools, which can reduce the consumption of alcohol in this country. And the next is, nowadays, it was not there in the era of madam. Nowadays, everything should be the evidence based. Until something is evidence based, it does not hold water in international scenario. So we need to produce the evidence based data on alcohol so that some policies, ultimately the policies can be framed, can be handed over to the respective bodies to be taken up, to be taken care at the country level. So these are the various objectives. I have tried to do justice by spelling these objectives before you, because this was to be done by Honorable President of AIIMS, and I think at the end of session we would be able to answer so many of these things. Thank you very much.